This is Akashvani. In the program Spotlight, now we bring you a discussion on Viksit Bharat Sankalp Yatra, strengthening health infrastructure through Pradhan Mantri Jan Arogya Yojana. The participants are Rohit Deojha, Joint Director, National Health Authority, and Arjun J. Chaudhary, Anchor.
In today's interview, we would be discussing about the Ayushman Bharat Yojana scheme, the composition of the scheme and how long the scheme has been, who the beneficiaries under the scheme are, and what is the future of the scheme as far as the citizens of India are concerned.
So this scheme, the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, was launched by Honorable Prime Minister on 23rd September 2018 from Ranchi. The scheme currently covers around 12 crore families. That would mean roughly around 55 crore individuals. The scheme ensures a health cover of rupees 5 lakhs per family per year for all these 12 crore families. So this scheme is like for poor and vulnerable population, and currently it is the world's largest health assurance scheme, which is covering 40% of India's bottom population. So these are the people who are poor and vulnerable. Like, we interact with a lot of people in our day-to-day life, like our drivers, our security persons, the maids who are helping us.
Mr. Jha, you have been with this Yojana for the last 4 years,
Right.
since its very inception. You're also a IRS officer of note, a joint director of the scheme as well. Apart from what you've already told us, can you highlight the key services being offered under the Ayushman Bharat PMJ scheme?
So this scheme is basically for inpatient service that we call hospitalization services. So all kind of hospitalization services across 27 specialities. We have around 1949 procedures for which we provide treatment under this scheme. And also there is one unspecified procedure. So basically like everything which includes into this cover amount of rupees 5 lakh for the secondary and tertiary care treatment are provided. So we have a specialties like oncology, cardiology, orthopedics, all big specialities we are covering under this scheme. Further, this scheme, whenever a person is admitted into the hospital, he is hospitalized. During his hospitalization tenure, we provide all kinds of services free of cost. That includes drugs, diagnostics, consultation, food and lodging. So it's all encompassing all kinds of services for the people who are admitted in hospital is provided under this scheme.
So apart from the key services being provided, as you just told us, what are the key achievements under the scheme?
So I would say that this scheme as on date has roughly catered to around 6.15 crore hospital admissions, and that has costed government around 78,000 crore rupees. In terms of like this scheme, beneficiaries are provided Ayushman card, and around 28.5 crore individuals have been provided Ayushman card as on date. If I talk about in terms of the benefit which has accrued to the poor and vulnerable people. So while the government has spent around 78,000 crore, these poor and vulnerable people have actually saved more than 1.25 lakh crore rupees of out-of-pocket expenditure, which otherwise they would have spent if these services would not have been provided under this scheme.
So how has this scheme transformed access to healthcare to the poor and vulnerable families? Spoken about the benefits of the scheme, but how did they get access to it? What was the awareness campaign?
Right. So I would say that at the core of this scheme, the philosophy is that the poor and vulnerable populations would be able to access healthcare services, affordable healthcare services at par with anyone in the country. So currently, if the big hospital, the corporate hospitals where these people were hitherto, they could not have afforded to have treatment. Now these people can have treatment, and that has been ensured through this scheme. So it has brought parity in access to the healthcare. Not only that, I would say that there are around 27,000 hospitals which are empaneled under this scheme, and that includes roughly 12,000 private hospitals. And if I talk about tier 2, tier 3 cities and the rural area, roughly 25,000 plus hospitals are empaneled in these areas. So one more thing, this scheme provides portability. Portability basically means that beneficiaries from any district, any state can avail treatment across any of the hospital empaneled in the country. So while I was telling you that around 6.15 crore hospital admissions have been authorized under this scheme, roughly 8.83 lakh hospital admissions have portability services. 8.83 lakh portability is hospitalization under portability has been authorized under this scheme. And that would have, so like people from the remotest place, it has helped into bridging the gap in access and breaking the barriers. like anyone from in the remotest part of the country can come and avail services in the top hospitals in Delhi and Mumbai or Kolkata, any of the metro places. So thereby it has effectively bridged this disparity in access to healthcare services.
So when we talk about portability and access, the focus has always been traditionally to the metropolitan cities.
Right.
What about the contribution of this scheme on healthcare infrastructure, especially in the rural areas and the other tiered cities?
Right. So while the core activity or core function of this scheme is to provide free healthcare services to the population, eligible population, at the same time, one of the byproduct of this scheme is that it has effectively strengthened the healthcare infrastructure across the country. And how it is? So first of all, under this scheme, all the public hospitals are deemed impaneled. So that would mean that any public hospital which has inpatient facility available, they are deemed automatically impaneled under this scheme. Now these hospitals, public hospitals, are paid at they are reimbursed the cost of the treatment at par with the private hospital. So the public hospital gets two kind of money. One, the budgetary allocation that they are continuously getting. Apart from that, this is over and above their budgetary allocation, which are the money which is reimbursed to them. Now this is an untied fund available to the public hospital. They are expected that the money which they are getting under this scheme, they would be using it for augmentation of the infrastructure and providing better amenities to the patients. And we have examples. We have states in the southern part of the country where there has been a huge transformation in the availability of infrastructure in public hospital through the money reimbursed under this scheme. So there are models where the hospitals have bought equipment, and they are also working on some kind of PPP model wherein they have engaged the private parties to run many of the facilities, like many of the equipments, through the money reimbursed under this scheme. Not only that, there are states where they have hired consultants, like medical consultants, using the money which has been reimbursed under this scheme. So thereby this scheme has been effectively able to augment the healthcare infrastructure in the rural area and also urban area. I would also say that as design of this scheme, we provide incentive to the hospitals who are operating in aspirational districts. So thereby we are also working like a catalyst that in areas which are deficit in terms of healthcare facilities, this kind of incentive actually attract private investment. So that way it is also working. I would tell you there are many states we have visited during our, like whenever we visit the states, we find that the money which have been reimbursed have been used to develop, there is a concept called Ayushman wards. Many of the hospitals have developed particular Ayushman ward for the beneficiaries of this scheme. The children wards have been developed from the money of this scheme. So a lot of development activities are going on with the money which are reimbursed under this scheme.
So, Mr. Jha, you've spoken about access, portability for the patients, those who are eligible patients especially.
Right.
Let's talk about implementation, because you need the active involvement of administration, doctors, nurses and staff. So at the ground level, how have you achieved that?
So first of all, this scheme from the day one has been envisaged as the Honorable Prime Minister's vision. This is a completely end-to-end cashless and paperless scheme. There is no component of paper in this scheme. So all the services are provided through a digitized system, and there is a proper monitoring, tracking of whatever is going on. So, and more importantly, most of the things are faceless in the terms the hospitals doesn't have to interact with anyone to see that their claims are processed and all of these. Beneficiaries, whenever they reach to the hospital, we have set up kiosks. We have set up around 10,000 hospitals recently under the direction of Honorable Union Health Minister. We have set up kiosks in the hospitals. Now these kiosks are the first point of contact for any beneficiary reaching out. They have been put up in the prominent places in the hospital, and whenever the patient or beneficiary reaches to a hospital, they are received there by the Pradhan Mantri Arogya Mitra in each of these hospitals. So these Pradhan Mantri Arogya Mitras facilitate these beneficiaries, because we know that these are poor and vulnerable categories of people. They need additional support because there is information asymmetry. So we try to breach that information asymmetry as well. And we have call center. We have 14555. 14555 ensures that whenever a person is visiting any hospital, if they are facing any challenge in accessing healthcare in the scheme, they can immediately call, and we have a provision of SOS help. So if a person requires an SOS help, suppose if he's at the hospital place and there he's facing some issue in availing the services, he can immediately reach out to our call center, and our call center will provide immediate resolution to the problem they are facing. Not only that, in terms of Ayushman card creation, because that is one thing which we are providing as a token of entitlement to the beneficiaries, as a part of Ayushman Bhava campaign, which was launched in September 2023 to saturate health ministry's programs, we have developed an Ayushman app. This Ayushman app can be downloaded from the Google Play Store, and any beneficiary can create their Ayushman card themselves. So there also we are trying to directly reach out to the people. We are also doing many IEC activities in terms of we are running campaigns on different communication channels so that the benefits under this scheme, the entitlement of the people reaches to them, and they are being educated and empowered to rightfully seek their claims. So a lot of activities we are doing to ensure that all the stakeholders are combinedly working towards achieving the goal of Ayushman Bharat.
So you've given us an idea, Mr. Jha, of how the patients are processed through the use of apps and Mitra, how they're able to access healthcare facilities, both urban and rural. What are the other technological advancements that we are seeing by which patients are treated, especially of their ailments and diseases, so that they get the proper benefits of under the scheme and they don't gravitate towards a more expensive form of treatment before private hospitals?
Right. So under this scheme, the technology is used in two ways. The first one is about the implementation of this scheme, which I said you before that this scheme is completely paperless end to end. And there we are having a system wherein from the time of registration of the beneficiary till the time of claim submission and claim settlement, discharge of the beneficiary, all of these is done on a technological platform. And there we are also using AI/ML, that is artificial intelligence and machine learning. There is no abuse by any of the stakeholders. There is another part of technology being used, that is about the technology used for the providing treatment to the beneficiaries. Now, when we started this scheme in 2018, there were 1359 procedures. Today we have 1949. So we annually revise the procedures which are being provided in this scheme and ensure that whatever technology is available in the market for treatment, and if they are available for mass deployment, if they have been tested and found to be fruitful for a mass deployment, then those technologies are included as part of the packages and the procedures which are provided to the beneficiaries. So it is very much fundamental to us that the quality of the treatment being provided is not at all compromised, and also that whatever the latest technologies are available, if, as I said, it is available for mass deployment, then they are being used under this scheme.
Is there a dashboard by which the patient is able to observe what the treatment has all been about, so that there's a historical data available with the patient as well?
Right. So we have two things here. We have a public dashboard wherein anyone can go and see the progress of this scheme. Is the way of we are being transparent about how we are implementing. So every data is being uploaded over there. You can see that, okay, how many transactions have been. So almost today we are providing 35 treatments hospitalization per minute under this scheme. So you can see that the numbers are changing over there. Apart from that, any beneficiary, we have a PMJY application, this PMJY app, wherein patients can go and see that what all treatments they have availed, and also they can reach out to any of the impaneled hospital whereby they can take that, find out that what all treatments have been provided to them.
Mr. Jha, I'll ask you finally, how is the Ayushman Bharat PMJ is doing in the Viksit Bharat Sankalp?
Right. So under Viksit Bharat Sankalp Yatra, Ayushman Bharat PMJY is a flagship scheme for Ministry of Health and Family Welfare. We have a clear target to saturate the Ayushman card creation, and this is one of the on-the-spot services which are being offered by the Viksit Bharat vans. So as on date, today itself we have completed 1 crore Ayushman card creation in the Viksit Bharat Yatra. We have also been able to deliver around 22 lakhs PVC Ayushman card to beneficiaries. Wherever these vans are reaching, their beneficiaries are sharing their stories. Meri Kahani Meri Jubani, under Meri Kahani Meri Jubani. Now this is like empowering many other and educating that how this scheme is able to effectively deliver the services, and encouraging them that, okay, whenever you would be needing these services, you can rely upon this scheme and go and avail services. So that way we are really able to tap on this Viksit Bharat Yatra to reach out all our beneficiaries.
Well, thank you so much, Mr. Rohit Jha, for giving us such a 360-degree understanding of the Ayushman Bharat Yojana scheme in terms of how one can access it, apply for it, be processed, get the treatment necessary, and ensure that you're a productive member of the society because your healthcare has been assured. Thank you so much.
Thank you very much.
You were listening to a discussion on Viksit Bharat Sankalp Yatra, strengthening health infrastructure through Pradhan Mantri Jan Arogya Yojana. The participants were Rohit Jha, Joint Director, National Health Authority, and Arjun J. Chaudhary, Anchor. This program was produced and presented by the News Services Division of Akashvani. You can listen to it on our mobile app News on AIR. This program is also available on our YouTube channel News on AIR Official. You may share your feedback about this program through email at airnsdtalks@gmail.com or WhatsApp on 928 909 4044.